It's a hot app and a hot topic right now. We're talking about TikTok, and researchers want to know more about what it's doing to our brains. In this week's Health Link, a local professor looks at how the popular social media app might influence teen mental health, particularly when it comes to suicidal thoughts. Seattle Pacific University psychology professor Dr. Keaney Law knew she had an idea for a new research project when she talked with her 13-year-old nephew about TikTok.
He put a screen time lock on himself, and I was just like, for a 13-year-old, that is amazing that you had the insight and the thought to do that. And so I was really impressed by that.
She started to hear more about TikTok from her colleagues and noticed a lot of tailored content on TikTok, including advice on mental health. So it got her thinking.
Nothing ever is all good or all bad. So let's figure out what is actually helpful about TikTok, because clearly the young adults and the adolescents are on it because it serves a function for them. It's doing something for them.
Here is a very easy skill.
Dr. Law, a licensed therapist, started posting her own videos on TikTok, but she wondered what other mental health advice is out there and is it trustworthy?
So I want to understand, okay, what is helpful about this app and what is actually harmful, so then that way we can, have our eyes open in this conversation.
Law specializes in suicidal thinking and wondered whether TikTok content influences suicidal tendencies. She launched an ongoing research project at SPU's Crisis Research Lab in collaboration with the UW to find out. Her study comes as suicide rates among American youth have trended upward. CDC data shows the suicide rate among people aged 10 to 24 increased 62% from 2007 through 2021.
I think a lot of the conversations around suicide and TikTok so far has been this algorithm that TikTok has, it's feeding really harmful content to our adolescents and our teenagers who are thinking about suicide and who are experiencing depression, and maybe even putting this idea into their minds. And so I think there's a really big conversation around that and a lot of concerns around that.
What struck Dr. Law especially is teens appear to be aware of the potentially harmful effects of social media.
They definitely recognize that they feel more depressed, essentially, when they're on there scrolling.
Amanda Foch also works in clinical therapy and is mom to a teen who's interested in more research on this.
The kids feel, in some ways, like a little abandoned by adults. Obviously, this is not great for kids to be on their phones all the time on social media. And it was like a way, I think, of just being able to express that and participate in that kind of inquiry.
Dr. Law agrees.
I think oftentimes adolescents and young adults feel kind of shut out from that conversation. And so I also, through this study, want to give them a voice to tell us, hey, what's happening on the app? How does it impact your mental health? And how do you think we can make it better?
Dr. Law is still recruiting participants between age 13 to 25. Keep in mind, you will need to submit your TikTok data for the research if you do become a part of that study. For more information, look for the story in the Health Link section of king5.com.